Good morning. Indian entrance exam will always talk about a muscle called as lumbricals. Whenever asked about the action of lumbricals, there is a big confusion. To remember the action of lumbricals, one of the leading comedian of the country, Kapil Sharma, has created a sign. If you remember that sign, you will never forget the action of lumbricals. In this show, this is the sign. Now this sign, we will not talk about the name, but we all know this sign. This is the action of lumbricals. Flexion at metacarpopharyngeal joint, extension at interphalangeal joint. It can also be remembered like this. You can make one L in your hand, L. There are 4 lumbricals. In each hand, 2 median nerve, 2 ulnar nerve. Median, ulnar. The action is this, and when the lumbricals are paralyzed, either median nerve palsy, ulnar nerve palsy or combined nerve palsy, it leads to a claw hand. Opposite. Hyperextension at MCP, metacarpopharyngeal joint, and flexion at interphalangeal joint. Claw hand can be median claw hand, can be ulnar or total claw hand. When you have claw hand and you try to correct the claw hand, you try to replicate the action of lumbricals and splint it in this shape so that you are bending at the knuckles, the metacarpopharyngeal joint, and extending the interphalangeal joint. This splint which gets this position is knuckle bender splint. So let's revise. Median, ulnar, action, paralysis, correction into knuckle bender splint. We must also remember, if we talk about the ulnar claw hand, there can be 2 injuries which can cause ulnar claw hand. 1, injury at the wrist. 2, injury at the elbow. If there is an injury of the ulnar nerve at the wrist joint, medial side, that will cause paralysis of the lumbricals, causing claw hand, and because flexor digitorum profundus will be intact, because it receives this nerve supply around the elbow, it will have more clawing because more amount of flexion will be there. As compared to it, if the injury is around the elbow, they will be clawing, but because the flexor digitorum profundus is also paralyzed because it receives this nerve supply here, the amount of flexion in the clawing will be less. So injury around elbow, called as high ulnar nerve injury, has less clawing. Around the wrist, low ulnar nerve injury has more clawing. So if I look on the right side, less clawing, injury around elbow. Left hand, more clawing, injury around the wrist joint. This is ulnar paradox. We can have 2 paradox. Low ulnar nerve injury, more clawing, or high ulnar nerve injury, less clawing. High ulnar nerve injury, less clawing has been described as the ulnar paradox. Why high ulnar nerve has less clawing? Because of paralysis of medial half of flexor digitorum profundus being supplied by ulnar nerve. Going further, the next question that comes on lumbricals is the space in our hand. There are 2 important spaces that you must remember. One is the thenar space in this area. Second is the mid palmar space covering this area. The thenar space contains the index flexor tendons and the first lumbrical, and the mid palmar space contains the other 3 flexor tendons and the other 3 lumbricals. So about the lumbricals, everything you should remember: median, ulnar, action, paralysis, knuckle bender splint, thenar space, rest 3, the mid palmar space. Read lumbricals for your exams. They are often asked, like in November in 2015, they asked you the question that there is hyperextension at MCP, flexion of interphalangeal joint. What is it? Claw hand. In May AIMS 2016, they had shown this image and asked, what is it? Answer was ulnar claw hand. Food for thought. I will be drawing claw hand on both the hands, and you will be guessing at your houses which one is paradox. Less clawing or more clawing? Right or left? So paradox, right side. Injury around elbow. Thank you very much. All the best.